MPs say as many as 1.5 million people in the UK could be addicted to prescription drugs. The Home Affairs Committee wants doctors to start collecting anonymous data on patients who might be at risk to work out how bad the problem is. Well, let's cross now to Los Angeles. We can speak to Dr. Gregory Smith, who's an expert in dealing with prescription medication addiction, and he's also made a documentary about the issue called American Addict. Very good evening to you. Thanks so much for talking to us, Dr. Smith. MPs here want to find out how big a problem addiction to prescription drugs is in this country. How big a problem do you think it is where you are?
Well, the problem in the United States is obviously enormous, and that's one of the reasons why I made the film. Right now, we have about 1 out of every 2 Americans using at least one prescription drug, and you have about 30% of the population using 2 or more prescription drugs every single day. And prescription drug abuse, recreational use that is, in teenagers is just going through the roof, especially in the category of 13 to 17-year-olds.
So what kind of drugs are we talking about? Are we talking about tranquilizers or sleeping pills? What kind of drugs do you mean?
Well, the biggest abusers, and again, there's a lot of prescription drugs that are used for blood pressure and things like that, but what I'm specifically talking about are drugs like OxyContin, Norco, Xanax. These are being heavily utilized, and the one disturbing problem and trend is that because OxyContin and some of these medications have a high street value, people are now turning to heroin. It's made a big comeback because it's actually cheaper than some of the prescription drugs that are being sold on the street right now.
Okay, and we don't know, I'm afraid, in this country what those kind of drugs are. We don't recognise those brands, but are people after, what kind of reaction are they looking for when they're taking them? Are they trying to feel high? Are they trying to feel chilled out? Why are they taking them?
Well, the hydrocodone, I think, is more of a universal name. Hydrocodone and oxycodone, these are drugs that are used for pain and chronic pain patients and cancer pain, and basically it just makes people very, very relaxed. Some people get a euphoria from it. It really sort of depends on the patient's DNA. Literally. Some people use these medications and they don't get very much out of them at all, but many people use these prescription narcotics similar to a patient or a person that would use heroin right off the street.
So who's to blame here? Is this doctors prescribing when they shouldn't be?
That's a big question. Who's to blame is, there's a lot of people to blame here. It's not just physicians. Physicians in this country are really used as the tool to get these medications in circulation. Big pharmaceutical companies have relationships with the media. In fact, we're one of only 2 really large countries that allow direct sales marketing to patients. In other words, we have commercials on the air all the time that are advertising direct to the consumers to go to their doctor and ask for certain prescriptions. The FDA has a relationship with the pharmaceutical companies where the pharmaceutical companies have to pay a certain amount of money, millions of dollars, to get their drugs authorized or approved by the FDA. And then at the same time, the FDA is supposed to be regulating these same companies that are paying them. So it's really a ludicrous association. So there's a lot of factors that have developed that have made our country, or the United States, be a situation where we're in a pills for problem society. Doctors just don't have time to spend with patients to find out the underlying cause. So it's a lot easier to simply give a pill for a problem, like they can't sleep at night, like they have pain, like they have anxiety. So instead of finding out the underlying cause, here's a pill for the problem.
Okay, Dr. Gregory Smith, very interesting to talk to you. Thanks very much.